Hello, my friends. I'm Dr. Julia Parker, urologist and senior health specialist. And today, we're going to have one of the most important and potentially life-saving conversations about medical tests that doctors routinely order for adults over 70, but that may actually cause more harm than good, and that you have every right to question before agreeing to them. I believe it's time to bring this critical information into the open with clear, compassionate evidence. The healthcare system doesn't always communicate well to older adults. Because when we understand which tests provide real benefits versus which ones create unnecessary anxiety, false alarms, and hazardous cascades of overtreatment, we don't just protect our health. We protect our daily joy, our independence, and the years we want to live well. Welcome back to a space where patient advocacy comes before protocol and where informed decision-making replaces blind compliance. Whether you're over 70 yourself or caring for a loved one in that season of life, what we're about to cover can help you avoid procedures that drain energy without adding meaningful time or quality to life. I've spent more than 2 decades caring for older adults and watching the difference that wise testing makes. And I've also seen the harm that comes from reflexively ordering everything just in case. Today, I'll show you how to tell the difference, and I'll give you a calm, practical script you can bring to your next appointment so you can keep what helps and safely skip what doesn't. Let's begin by dissolving a myth that sounds sensible, but quietly causes trouble. The idea that more testing always equals better care. At 45, some screenings clearly change outcomes. At 75, the risk-benefit math can flip. Bodies process anesthesia differently. Recovery takes longer. Incidental findings become common. The chance that a slow, tiny abnormality will ever matter in your natural lifespan goes down, while the risk that a test starts a chain of follow-ups you didn't need goes up. None of this means turning your back on medicine. It means practicing mature medicine, care that matches your stage of life, your goals, and the kind of days you want to keep having. Your guiding question from now on is gentle and powerful. Will this test change something important about the next year of my life? If the honest answer is no, you can likely skip it. If the answer is yes, we proceed, but we do so strategically with the smallest effective step first. You deserve specifics, not slogans. So let's talk plainly about 5 testing categories that frequently become problematic after 70 and the equally important group of evaluations that still make sense to keep. I'll weave in true-to-life scenarios and exact words you can speak to your clinician. You'll hear me repeat one theme in many forms. Personalization beats protocol. Because a calendar age is a weak compass, function, values, and realistic outlook steer us far better. Consider the blood test many older men know too well. A borderline number can trigger repeat labs, imaging, and a biopsy. A biopsy can lead to infection, bleeding, and weeks of worry. If a slow-growing lesion appears, the momentum often points to surgery or radiation, even when those treatments carry a high probability of daily side effects in exchange for little or no extension of life. If you're in your 70s or 80s, the most important sentence to carry into any discussion about that test is this: given my age and overall health, is finding and treating something small here likely to help me live longer or live better? Or will it mainly introduce side effects I'll feel every day? Ask also, what exactly happens after any result? If the plan is let's see, rather than a clear, evidence-based next step that improves outcomes you care about, it's a signal to pause. Monitoring with a light touch and strong criteria for action is often the wisest plan in this chapter of life. Now travel with me to the colon. In midlife, colonoscopy can be a lifesaver. After 75, especially if you've had normal colonoscopies before, the equation shifts. Preparation can dehydrate and exhaust. Sedation lingers longer. Complications rise with age. Meanwhile, the chance of a newly discovered, fast-moving problem that truly alters your lifespan becomes small. That's why many older adults pivot to home-based stool tests as a low-burden alternative, only moving to colonoscopy if a non-invasive screen signals a real concern. Here is your polite, effective line. I've had normal colonoscopies in the past. Given my age and history, could we use an annual stool test first and reserve colonoscopy for when it's truly indicated? This isn't avoidance, it's strategy. Older women face a different kind of decision fatigue around breast imaging. The tool is sensitive, but sensitivity without context fuels callbacks and biopsies of very slow changes that may never matter. The key question is not can we find something? It's will finding and treating this improve my years ahead? If your energy is precious and your calendar runs on a tighter budget than before, it can be reasonable to shift towards symptom-driven evaluation or longer intervals, especially when your overall health suggests limited benefit from aggressive hunt-and-treat cycles. You can say, if a small, slow lesion is found, would treatment truly add time to my life or mainly subtract comfort and energy? That single question invites a care plan that honors your reality instead of an idealized protocol. Glucose targets deserve the same wisdom. Many older adults carry the hidden burden of chasing perfect numbers. But strict control often creates more lows, more falls, more confusion, and more hospital visits. Harms you feel today, benefits you may never live to realize. A gentler target range, a simplified regimen, and snacks timed to your activity can stabilize your days remarkably. Ask your clinician, what target keeps me safe and steady without risking lows? Which medication contributes most to those drops, and can we adjust or replace it? When the goal shifts from perfection to function, walking confidently, sleeping well, thinking clearly, you feel the difference in a week, not a decade. Let's also address the modern temptation to scan broadly just to be sure. Without a specific symptom to answer, big imaging often finds small, ambiguous spots. Once written in a report, those spots attract more tests like magnets, yet many would never have affected your life. The most protective sentence you can speak is this: what symptom or physical finding makes this scan necessary? And if it shows a small, unclear spot, would that result change my treatment or just lead to more tests? If the honest answer is more tests, you've just saved yourself months of worry and appointments that don't return anything valuable. So those are the screenings to often skip or at least rethink. What about the ones to keep? Your time and energy are precious. The evaluations we keep are the ones that help preserve independence, prevent crises, and protect your ability to enjoy daily life. Blood pressure measurement is a keeper, not because numbers rule your life, but because gentle control of blood pressure lowers the risk of stroke and protects brain health. The goal is steady, not strict. A home cuff and a simple log can identify patterns without labeling you sick every morning. Vaccinations matter because they prevent infections that send older adults to the hospital more than any other reason. Influenza, COVID-19, and pneumonia shots aren't about fear. They're about keeping your lungs calm, your energy stable, and your life uninterrupted. Vision and hearing evaluations are quiet heroes. Clear sight prevents falls, and hearing preserves social engagement, which protects mood and cognition. Dental care is a fall prevention and heart health tool when you consider how oral health interacts with nutrition and inflammation. Balance assessments and fall risk checkups are worth their weight in gold. A single prevented fall can save months of recovery. Bone density has a role when your personal risk suggests weak bones, not because every 70-something needs a scan, but because targeted treatment after a documented issue prevents fractures that change the story of a life. Abdominal aortic aneurysm screening makes sense once for certain older men with a strong smoking history, not as a repeat hobby, but as a one-time strategic look. Medication review is an unsung screening that pays dividends. Removing drugs you no longer need often improves clarity, steadiness, and sleep more than adding anything new. Mood and memory check-ins with simple tools can surface treatable issues early and support families in planning kindly. These are the keepers. Their common link is simple. Each one has a credible chance to improve your next year, not just your chart. I want to give you a compact, repeatable script to carry into every appointment. Write this on a card and keep it in your wallet. First, with my age and health in mind, how would this test change what I do tomorrow, next month, and in the next 12 months? Second, if the test finds something small or uncertain, what is the exact next step, and what are the risks for someone like me? Third, is there a simpler, less invasive alternative that gives us the same useful information with less burden? And I'll add a fourth for those moments when the room is moving fast. Can we wait 3 months while I optimize sleep, hydration, movement, and medications, and then reassess? Many borderline issues resolve when your foundation improves. Let me show you how this looks in real life. Irene is 78 and lives alone by choice. The clinic calendar flagged her for a due colonoscopy. She brings her card and says, "I've had 2 normal colonoscopies, and anesthesia lingers for me." How would repeating this change the next year of my life? Could we use a stool test each year and reserve colonoscopy only if that flags something? The clinician pauses, smiles, and agrees. Irene spends that week tending roses, not recovering from a procedure. 2 years later, still no red flags. She kept the screening that mattered, stool testing, and skipped the one that didn't. Samuel is 82, a retired mechanic with a tremor that makes mornings slow. His fasting numbers are not perfect, and a well-meaning provider suggests tightening his regimen. Samuel reads from his card, "My mornings are already shaky. What target keeps me steady without lows? If we chase tighter numbers, what is my risk of falls?" They adjust the plan, simplify medications, and include protein at breakfast. His mornings settle, and he returns to his sidewalk chats with confidence. Marta is 76 with a strong spirit and a sensitive stomach. A routine imaging test reveals a tiny spot in her lung. The report says indeterminate significance. Her team proposes a CT follow-up in 3 months. Marta brings her card and asks, "What exactly would we do differently if the spot remains the same or shrinks?" If the answer is keep scanning, she wonders if living 3 months under a cloud is worth it. Together they decide. Focus on walking, sleep, and stress ease. Update vaccinations for the season, and reassess only if symptoms appear. 3 months later, she feels better in every measurable way and forgets about the spot because her life got bigger than the image. Let's talk about foundations, because the best way to avoid unnecessary testing is to reduce the vague symptoms that generate it. Circulation, sleep, and calm breathing are your 3 natural allies. A daily walk, 10 minutes after meals, is a circulation treatment disguised as a simple habit. It warms the hands, lightens the legs, steadies glucose, and lifts mood. Gentle ankle pumps in a chair wake up the calf muscles that push blood back to the heart. Hydration matters more than most people realize. A glass of water first thing in the morning reduces wooziness and brings blood pressure to a friendlier place. Magnesium, especially in a form that's kind to your stomach, like magnesium glycinate, can support vascular relaxation and quiet nighttime cramps, helping you fall asleep and stay asleep without heavy sedatives. None of these are heroic. All of them make your body more cooperative. When your baseline is calm and well circulated, You're less likely to enter clinics with worries that lead to fishing expeditions. I also want to give you language for when you feel rushed. You can say, I hear that this is standard, but my priority is functional. I want to keep walking to the park, sleeping through the night, and cooking on Sundays. Help me understand exactly how this test protects those goals in the next year. If we can't draw a line between the test and those goals, let's wait. You are not being difficult. You are being precise. Precision is kindness to yourself. Now let's honor the screenings to keep with equal clarity. If your blood pressure is regularly above a safe range, modest, well-chosen treatment helps you avoid strokes that change lives overnight. Your alchemy here is steady dosing, regular checks at home, and realistic goals that do not leave you dizzy when you stand. If your vision has dimmed, a simple refraction, cataract evaluation, or lighting upgrade at home can prevent a hip fracture by preventing a missed step. If you find yourself asking people to repeat themselves or turning up the television, a hearing evaluation restores connection to conversation, the most protective social medicine we know. If you've been losing weight without trying or you feel full after a few bites, a targeted evaluation checks for treatable causes like medication side effects, oral issues, or digestion changes. Oral health visits matter because painful chewing leads to poor nutrition, which leads to weakness, which leads to falls. Cleaning, simple repairs, and a plan for dry mouth change that cascade. If you wobble when you turn or you've had a near fall, a balance and strength check with a physical therapist is not a test to skip. It's a doorway to simple exercises that cut your risk of falling in half. And if your mood has been flat for weeks, or your interest in daily things has quietly faded, a brief screen for depression is a kindness, not a label. Treatment in later life is often lighter, more behavioral, and surprisingly effective. I want to tell you about a couple named Tom and Lila. He is 79 and playful. She is 77 and practical. They came to me fatigued from months of appointments. We spent one visit doing nothing but mapping what to keep and what to skip. Keep: blood pressure checks, vaccinations, vision and hearing, dental care, a balance screen, a medication review. Skip for now: a repeat colonoscopy after 2 normal exams, a broad scan for absent symptoms, and blood work with no clear plan attached. We also wrote their 3 questions on a card and taped it to the back of their insurance card. 3 months later, they'd had fewer appointments, more energy, and one delightful moment at the pharmacy when Tom realized he no longer needed a pill that had quietly been making him lightheaded at night. That was not a miracle. That was subtraction. Families ask me how to advocate without conflict. Bring a second set of ears to important visits. Sit side by side, not across, if you can. When a test is proposed, ask for the question it is meant to answer in 1 sentence. If a clinician can say, "We are doing this to answer whether your new dizziness is from your heart rhythm," you're on good footing. If the purpose is vague, just to see, ask to revisit after sleep, hydration, and medication review. You're not saying never, you're saying not yet. And if someone suggests that declining a test means you don't care about your health, smile and say, "I care deeply." That's why I'm choosing the tests that help me live well this year. You might be wondering, what about emergencies or new serious symptoms? The compass still applies, but the path changes. New chest pain, sudden weakness on one side, severe shortness of breath, black stools, fever with confusion, those are signals to seek care urgently. Targeted testing in those moments isn't optional, it's life-preserving. Even then, once you're safe, ask the same 3 questions to shape the next steps and avoid add-ons that don't change your outcome. I want to take a moment to speak to caregivers. Your presence is medicine. You can lower the temperature of a room just by bringing calm questions and a notepad. Ask the clinician at the end of a visit to state the plan in plain words. Today, we are doing X because of Y. If the result is A, we will do B. If it is not, we will do C. And if you feel better with the foundation care we just reviewed, we will stop. That last sentence, "and we will stop," is a gift. It prevents momentum from carrying your loved one where no one intended to go. Now, for those who like to try a gentle mineral to support circulation, consider choosing a form of magnesium your stomach tolerates. And share that plan with your clinician if you take blood pressure medicines or have kidney concerns. If your legs cramp at night, if stress tightens your chest despite a normal heart check, or if sleep resists you, a small daily dose at dinner may help your vessels exhale, your muscles soften, and your nights lengthen. Match it with a glass of water on waking, a short walk after meals, and simple calf raises while brushing your teeth. That combined practice, modest as it is, has helped many of my older patients feel like themselves again, lighter on their feet, clearer in their heads, and less interested in tests that chase feelings already resolved. I'll share one more story from clinic that still makes me smile. Harold is 80, widowed, a retired math teacher who collects jokes like seashells. He arrived with a stack of orders, lab panels, 2 scans, and a referral for a procedure he didn't understand. When I asked about symptoms, he paused. "Mostly, I'm tired of being tired." We looked at his medications and found 2 that interacted to cause morning grogginess. We lowered a dose, shifted a timing, and added a 10-minute porch walk after breakfast. He took a small dose of magnesium glycinate with dinner to quiet his calves. 2 weeks later, he canceled 3 tests on his own. I asked why. He grinned. "I don't feel sick anymore." That is the power of foundations, thoughtful subtraction, and the courage to ask why before you say yes. Let's gather everything we've covered into one breath you can carry forward. Tests are tools. None are sacred. Some help greatly after 70. Blood pressure checks, vaccinations, vision and hearing care, dental visits, balance and bone risk assessment when indicated, medication reviews, and mood and memory check-ins. Others often help less than their reputation. Routine prostate blood tests in very old men without symptoms. Repeat colonoscopies after a string of normal exams. Default mammograms in women with limited expected benefit. Strict glucose control targets that trade function for numbers. And broad scans that hunt without a question to answer. The difference between skipping and keeping rests on a single filter. Will this test likely improve the next year of my life? You can ask for the smallest effective option first. You can request time to improve sleep, hydration, movement, and medication simplicity before testing. You can make decisions that privilege your mornings, your walks, your laughter, your errands, your time with friends, and your quiet. If you're listening with someone in mind, perhaps yourself, perhaps a parent or partner, choose one change to try this week. It could be placing a glass of water on the bedside table tonight. It could be writing the 3 questions on an index card and sliding it behind your health insurance card. It could be calling the pharmacy to ask for a medication list and booking a short visit just to review what you might safely stop. It could be stepping outside after lunch for a 10-minute spectrum of light and movement that your blood vessels love. It could be replacing the word routine with the word relevant when you think about screening. That small shift transforms the tone of your next visit. I want to leave you with a single sentence to guide everything. The best screening after 70 is the one that clearly protects your function and comfort in the year ahead. If a test can't make that promise, it may not deserve your time. If a habit can, hydration, walking, steady breathing, gentle minerals, kinder medication goals, start there and let your body show you what wise care feels like from the inside. Your health is not a checklist. It is a living conversation between your values and the evidence. You have permission to lead it with grace. If this message brought you clarity or calm, consider sharing it with someone who is weary from too many appointments. Invite them to try the card, the questions, the walk, the water, the laugh. In this season of life, we protect each other not with more noise, but with better signals. I'm glad you're here. And I'm proud of you for choosing mature, thoughtful care that keeps what truly matters and lets the rest go.